Let's talk about something really important, but maybe not something we think about enough. What happens after a patient leaves the ICU? It's a journey that's full of challenges, but a new clinical tool is actually starting to provide a much-needed map for that recovery. So let's get into it.
Look, surviving a stay in the ICU, that's a huge victory, no question. But for so many people, the fight is really far from over. The second a patient rolls out of that high-tech, super-monitored environment, a whole new and honestly pretty daunting journey begins. So the real question is, are we actually ready for what comes next?
For a lot of patients, moving from the ICU to a regular ward can feel like falling off a cliff. You go from constant, one-on-one surveillance to a setting that's way less intensive. This handover, this single moment, is incredibly high risk. It's where critical information about what they need for rehab can just get lost. And when that happens, well, it can mean slower recoveries, complications that were totally preventable, and even a higher chance of being readmitted. That puts a massive strain on everyone, the patient and the whole healthcare system.
So the big question is, how do we build a bridge over that gap? How do we make sure that this critical move is safe, smooth, and really tailored to what each patient needs? Well, the answer lies in having a clear roadmap, and that's exactly what this new clinical tool is designed to be.
It's called the Post-ICU Presentation Screen, or PICS for short. Now listen, this is not just another form to fill out, okay? Think of it as a dynamic tool that does two really key things. First, it figures out a patient's specific rehab needs, and second, it helps create a management plan for their recovery as they move from the ICU to the ward and even beyond that. And its design is just brilliantly simple. The Intensive Care Society developed it, and it's a super focused 14-item screen. And its brevity? That's its superpower. It lets staff use it quickly and effectively right in the middle of a busy hospital, helping to make that handover and triage process so much smoother.
Okay, so we've got this 14-point tool, but what does it actually do for an individual patient? This is where it really stops being a simple checklist and turns into a true guide for recovery.
This quote right here just nails the whole idea. The tool helps create what the source material calls a rehabilitation prescription. Just think about that for a second. Like a prescription for medicine, this is a personalized, super-specific plan that lays out exactly what kind of therapy and support a patient needs to get better. It's custom-tailored care, not some one-size-fits-all approach.
So let's break down how this tool actually builds that recovery plan. There are 5 key ways. First, it makes sure the handover is smooth by flagging the most immediate needs. Second, it's the bedrock for that personalized rehab plan we talked about. Third, it calls in the right specialists when they're needed, like a physiotherapist or a speech therapist. Fourth, you can use it over time to actually track progress. And finally, it helps plan for services a patient might need right away on the new ward.
So that's the massive impact on just one person, right? A faster, safer recovery. But this is where the story gets even bigger. The true power of this tool really gets unlocked when we zoom out from a single patient and start looking at the health of the entire system. Here's the crucial point. Every single time that PICS tool is used, it creates a data point. And while one data point helps one patient, when you start gathering thousands of them, well, all those individual rehabilitation prescriptions suddenly become a detailed blueprint of what the entire population needs.
And with all that data, we can literally see the gap between what patients need and what the healthcare system can actually provide. For the first time, hospitals can go from just stories and guesswork to hard numbers. They can quantify exactly where the shortfalls are and make a solid, data-driven case for future planning and getting the right resources. It turns speculation into strategy.
Okay, let's pull all this together. What we're really seeing here is the incredible dual impact of one smart, simple tool. It's working on 2 levels at the exact same time, the individual and the entire system.
So, on the one hand, for the patient, it's their personal roadmap to recovery. It makes sure their journey is safer and more coordinated. But on the other hand, for the hospital and the bigger health system, it's a powerful diagnostic tool that shows them exactly where the gaps in care are and helps them plan for the future.
So if you only remember a few things from this, here's what they should be. First, this tool is way more than a checklist. It's a real planning instrument. Second, it builds that crucial bridge over the dangerous gap between the ICU and the general ward. Third, and this is so powerful, it turns one person's data into system-wide knowledge. And finally, it lets us actually measure the gap between what our patients need and what we can currently give them.
And all this leaves us with a really fascinating question, doesn't it?
If we can use a simple, data-driven tool to create a clear roadmap for one of the most complex transitions in a hospital, what other tough patient journeys could we map out, manage, and improve using this exact same idea? It's a pretty compelling thought for the future of healthcare.